Hey everyone, welcome back to the BioNexus Health podcast, Autism Uprooted. Today, I will be dividing the podcast into two parts in the essence that, we'll be discussing some strategies regarding a dairy-free diet. Many moms express concern over the possibility of calcium deficiency when going on a dairy-free diet. So I will be discussing that first. And then in part two, which will be aired at another date, we will be discussing about the clinical and lab aspects of PANS, PANDAS, what happens when you get a negative throat swab, etc. So I am very grateful to have the wonderful Alexandra from UK with me here again today. And so let's proceed and welcome Alexandra to today's podcast.
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hey Alexandra, how you doing? I'm so glad you're here.
Hi, Dr. Dashore. How are you? I'm okay.
Good.
Just getting ready for Christmas now.
Yes, I know. Yeah, time flies. I'm telling you, yeah, us busy moms.
Yeah, I've got all my decorations downstairs and the boy has started just decorating the Christmas tree. Obviously, I'm going to take everything off and do it again, but I'm just letting them have fun.
Are you planning on going back to Romania or you're going to stay in the UK?
Actually, this year we've got all friends and family from Romania traveling to us, to UK.
Wonderful.
Because, and again, this is I'll say because of you, although it's not the correct form, but I'll say because of you. We had so many holidays this year, and we've been so many times, Romania, Cyprus, Spain, everywhere. Basically now all the family is coming to us because we need a break from so many flights in the last period.
But yes, that is so amazing. Well, it's been my pleasure. It's been my privilege to help the boys and your family. And it is so great to bring families together. I say this often, but it's true that I always think about all of you out there, as in some way, part of my extended family. So it's great to have, friends and family in 93 plus countries. I love it. I love it.
Good feedbacks from everywhere. But for us last year, and especially this year, after all the adventure with Patrick since September, our life has changed a lot and we are just living the dream. I can say that now we are literally living the dream with all the changes that we've done, not just the protocols, everything that we've done, including school and all the things that we had to adjust. Now we are literally living the dream. We are living a flu, viruses, winter free.
Yeah.
And, we are just enjoying time with the boys, traveling a lot, enjoying school a lot, and yeah, literally everything is amazing. Thanks.
Oh, bless your heart. Bless your heart. Okay, so today we will first talk about, you putting your boys on a completely gluten-free and specifically dairy-free diet. So that's what this podcast will be focused on, right? And how have you managed, did you ever have a concern about calcium? Because many moms ask me, should we be supplementing with calcium? It's almost an obsession that milk and dairy and cheese is so essential for growing babies. And it's just, something important to many families, right? Because it's associated with like no dairy, no calcium, no growth. So what has been your experience?
When I first started my journey into the biomedical world, these were the first thing that I have learned about being gluten-free and dairy-free. We have a big background with ENT problems in regards to ear infection, nose, throat infections, adenoids, and tonsils. And as many moms should know that these are in a, I don't know, direct relation with dairy intolerance. This should be the first thing that you should take out when you start the healing process or the recovery, call it however you want. So when we have first implemented it, as I was learning, first thing that you do, you just go to the shop and you start buying dairy-free products because you don't know and you haven't got to that point where you have read enough to know that you need to avoid it completely and you need to really look into the ingredients list. So I was going to the shop and I was like, oh, that's easy. Diet is easy. I'm just going to go and get a yogurt that is dairy-free. But it's not that easy. We really need to remove all these allergens completely from the diet if we want to see the results. It's not enough to take products that are gluten-free or mainly dairy-free just to avoid the lactose or casein intolerances that these kids might have. And in my experience, taking them off has literally within 3 weeks taken us to the remission of adenoids and tonsils when we did it. I've got, as I will show you a bit later, tests from 2022 with the calcium being at the right level, just for the people to understand. So basically, Philip has been born in 2019, and by 2020, yes, we have already started the diets for him. So he was already gluten-free and dairy-free. And the first result is within the range for calcium. And the second one is even more. So if at the beginning, when I was a beginner and I didn't know much, I haven't been worried. And the nutritionist from the NHS was telling me, I don't want him to be on a dairy-free. What he's going to do with all that calcium? He needs calcium for his bone because you're complaining that he's not able to walk and he's losing strength in his legs and pain in his hands. And I was like, lactose is causing inflammation. Casein is causing inflammation. Why would I give him this? And she was like, no, not at all. He needs it so he can just keep his calcium level. I'm not going to agree with you unless you give him a calcium supplement. And I was like, you can't give calcium supplement to a baby just because you want to supplement it because he's dairy-free or casein lactose-free. Calcium, from my knowledge, and you can correct me if I'm wrong, can't be given as a supplement because it can create deposits, isn't it, into the bone?
That is true.
It can
Yes.
take to a different sort, especially for the kids with autoimmune disease. If I'm not wrong, correct me.
No, you're not. So hold on just for a second. So yes, everything that you said, I just want to briefly summarize, right, for those listening. So you started with Philip, around 1.5 years of age. You already went on a gluten-free and dairy-free diet. So prior question to that would be, was Philip breastfed?
Yes.
For how long did you breastfeed?
For 1 year and 4 months.
1 year. Okay, good. Okay,
exactly.
So 1 year and 4 months. Right.
Yes.
So he's received that nutrition, and then you saw symptoms and you decided to go dairy free. You measured his calcium in the blood work. It was fine at that time. And then yes, your research is accurate, right? Calcium causes inflammation. You saw a reversal of his, sinus, ENT symptoms, adenoid, tonsils. And the funniest thing is that the dietitian refused to work with you because you wanted to be dairy free. Well, yes, calcium supplements at any age, you have to be careful. First of all, calcium supplements, if calcium is more than what the body needs, right, then yes, it can cause deposits. In an autoimmune condition, it can cause devastating kind of deposits. I have one child with PANS, which was not diagnosed for a while until the child ended up with scleroderma, which is, we know that, if autoimmunity continues, then different diseases like psoriasis, scleroderma, these diseases can happen in our children. And now, by the time the child came to me, he was already 9 years, or he is 9 now, already 9 years old. And the poor kid had calcium deposits in his finger joints. And, they've tried everything. That's another story. So yes, that's one. And second is, excessive calcium can overly alkalize the body. It's a very alkaline mineral, right? So the body cannot be alkaline 24/7, right? We know that an acid alkaline balance has to be maintained. And number three is calcium can often hinder absorption of another important nutrient, which is very important for blood flow and brain health and overall health, your iron. It can interfere with that as well. So supplementation is, I don't really encourage unless there is, a massive clinical deficiency and you're not able to supplement through diet. So keep in mind, there are always some scenarios where there are children who are really picky eaters, etc. So that, whoever comes to an appointment, we usually discuss individual cases on an individual basis. But today's podcast is to talk about the inflammation potential of dairy for many children on the spectrum. And so, Alexandra, you were saying that Philip had, muscle issues. He had, right? And the underlying reasons were autoimmunity, was Lyme disease, etc., which, you probably researched. But it was being attributed, oh my God, he's got all these problems already, so he needs calcium.
Yes, because they were thinking when he was having the episode of illness, for him, the regression was showing up as losing his ability to walk. So from a walking toddler, he would have been down in his knees and not being able to walk anymore. And we dealt with that problem until we met you and we've sorted out the biggest problem.
Yes.
We've ended up being paralyzed when we got to you. And all the time, she was just pushing me to go to the milk supplement, to consume milk, dairy, cheese, anything, just to strengthen his bones, because his bones might be weak. And I was like, how can he walk now? And after a flu, he can't walk anymore. So his bones are weak just after the flu. He's just he's got deficiency in calcium just after the flu, and then he's okay, although he's not consuming the products. And yes, because he has been dairy free, we have never had deficits on calcium. Even more, we are showing like a growing path in calcium and in nutrients absorptions since we are on the protocol.
It has increased, yes. And we'll take a look at the labs as well towards the end. But, so there was another important point you mentioned, Alexandra, is, as soon as you decide to go on a dairy-free diet, don't just run to the store and start buying, almond milk, soy milk, mixed milk, whatever, vegetable milk, I don't know, all of these cashew milk and all these strange products, because there might be additional ingredients that are equally inflammatory, if not more. than dairy. And we have to understand, right, that our children don't have that kind of detoxification capability. And if there is Lyme disease, if there is mold exposure, then the liver and the other detoxification pathways are already super stressed. So we don't really want to, add on added load. And you will often find a child will go into a pans pandas flare, which if you don't know that your child has PANS, not just autism, or has been misdiagnosed with autism, then you think this is all part of autism because the symptoms look very similar. So
Exactly.
that's a really important point. I have couple videos, and one recently released on how to make almond milk at home, right? If you're so obsessed with the milk aspect of things, then how to make almond milk at home. And it takes 5 minutes, literally, to make it for the whole week.
Because of the restrictive eating, parents always think like, okay, what should I replace it with? I'm not giving him dairy milk. I'm not giving him cow milk. Let's give him something that is going to replace. Well, things are not necessarily working like this. We really need to remove everything that is causing inflammation, not replace it. Literally remove everything that is causing inflammation.
Good point. Yes. So, removal. And again, I mentioned if someone has severe dietary pickiness or restrictions, obviously, you and I will discuss and we'll come up with a specific plan. But we are speaking in broad terms, which applies to most children on the spectrum today. So, how did you what kind of strategies did you introduce in Philip's diet? I mean, both your boys, but let's stick with Philip because we are
About Philip,
yeah.
we done the allergen test, and Philip was literally intolerant to most of the things, like from potato to egg to everything. So I ended up with just a couple of ingredients that I was able to cook with. So it was just sweet potato, chicken meat, um, carrots, peas, whatever. So I was just flipping them from breakfast to evening, and that would have been the same meal, only that in the morning I would have had, I don't know, maybe some meatballs made out of the same ingredients, and in the evening it would have been like just the chicken with vegetables on the side. It would have been the same meal, but this was my strategy, just to bring down inflammation. And then after the inflammation went down, I had started to add on the other uh, false positive um, ingredients that were showing as causing inflammation, although they were not. But the main inflammatory products, which is dairy, gluten, soy, they've been removed.
From their diet, yes. Okay. Once again, let me explain what Alexandra means by false positive on the food allergy testing. So be aware that when your child has underlying medical issues, we mentioned PANS, PANDAS, Lyme disease, biotoxin illness, mold exposure. So when there is so much inflammation underlying, oftentimes the food allergy testing is pretty much a waste of money. However, if you do decide to do the food allergy testing, what is useful is the ones that show up as highly allergic, that's completely in the red zone. So either avoidance or minimization only of the ones that show up as highly allergic or in the red zone would be worth it, if you haven't explored the other aspect of your child's medical health, if there are any medical underlying issues. Because it is so interesting that if we run the same test now, it is, that's exactly what happened with me as well, Alexandra. Now, you had the same things which you were trying to get creative with, right? You were making, grilled chicken, and then you were doing chicken meatballs. For
Or chicken
me,
soup is the
the
same
chicken
chicken.
soup, exactly, yes, with the vegetables. Like for us, it was Brian's immune system, it took us a really long time to understand all of the underlying issues with him. So his immune system was in a very bad state, right? So I had to come up with completely different menus for 4 days. So whatever he was having on Monday, nothing was duplicated on Tuesday
Yeah.
and so on. So I had 4 different menus, and then, Monday, Tuesday, Wednesday, Thursday, and Friday, he would have everything that he had on Monday. I mean, literally every single ingredient, even spices. Crazy, crazy. It was just, if only I had realized that it was this TGF beta 1 melanocyte stimulating hormone, VIP, the mold exposure that was causing this outbreak of inflammation, even after treating the Lyme. The markons were not addressed, etc. So yeah, right. So now from fruits, vegetables, chicken, and a few other limited items that Philip was on. We started him on herbals. We discovered the underlying issues, and the people who have followed Alexandra will know that Alexandra, has shared Philip's video that the legs went back to normal, the facial muscles went back to normal, and from being paralyzed, Philip went to going outdoors and playing soccer and growing and thriving. And right, Alexandra, how is he doing?
I haven't been like properly prepared, but I would show just quickly on my phone
Okay.
video from a party with Philip. Just he's running and playing laser tag with his friends.
Wow. Yeah, that's him running in the background. Yeah.
It's just happened like last night when we were going to a party. We started online schooling because I wanted them to be fully recovered. I don't want them exposed to anything. And their social life is even better than from the time they were in school, and we didn't necessarily had time to do anything, but everything came back to normal. So I'm really, as I said at the beginning, I'm really enjoying time with my kids. And I don't know, it's a completely different life. Look, they were getting ready for St. Nicholas. They were preparing their boots. I don't know. It's different.
Yes.
It's different.
Yes.
And Philip has gained a lot of weight. Not being, I don't know, overweight or anything like this, but he was skins and bones. We would have seen his skull through his face.
Yes.
And now he is completely different.
Oh.
We were recording a video
So
for
cute.
school, so
Yes.
this is
Yes.
what's happening now.
Yes, he's a completely different kid. Yes.
He is.
One thing that I wanted to mention was, and it's very easy to research if anyone wants to research, is one additional thing with dairy and gluten, right? There is something known as, gluteomorphine type reaction and casomorphine type reaction. So this is, that can, many children have this kind of a reaction to dairy, the casomorphine. It's a opioid type reaction, and you can see an increase in the symptoms, especially the stimming, the obsessive compulsive symptoms, not just the physical actual, nasal congestion, chest congestion, adenoid and tonsil inflammation that Alexandra mentioned, but the casomorphine reaction can happen as well.
So I explain this in parents' terms so they can understand this like a bit more
Go
visual.
ahead. Yes.
So for example, you will see kids diagnosed or not with autism, craving chicken nuggets and cheese or chicken nuggets and milk, the effect in their brain is the same as morphine does to I don't know, a sick person that needs morphine, just to diminish the pain and the inflammation in the body. So they are choosing this sort of inflammatory foods just to feel numb. Is this correct, Dr. Dashore?
Yes, yes. It's like they're craving a hit. It becomes an addiction to any opioid. Well, the example Alexandra gave was morphine. Yes, so they are craving a hit. And I'm glad you mentioned that, because many parents think that, it is important to listen to the natural cravings of the body. So in this case, you need to educate yourselves and be aware, right? And then, you hear all kinds of things. My child has a folate receptor blocking binding antibody, etc. That is, not a problem. You need to be dairy-free completely and give it a try. See if the inflammation comes down. Look into underlying medical issues. And any kind of autoimmunity, just like the folate binding antibodies, the pandas, you will find things gradually getting better and improving. Obviously, genetic mutations don't go away, but just because there is a genetic issue doesn't mean it is expressing, it is active, it is acting out right now, right? So when you modify your lifestyle, that's called as the epigenetics. When you modify what you eat, how you live, food, water, the air you breathe, then your genetic predispositions, genetic mutations will not express. Like, there's a lot of fear in people's minds about that as well. Lastly, what I would like to address in brief, before we go to the labs that Alexandra is going to show us, is there is a lot of information online, so it is your responsibility as a parent to research versus just, this supplement helped, according to the mom of this child on the social media group, this supplement helped this child. So I'm going to go ahead and experiment with that on my child. That sounds absurd. Every child is different. And one of the things that I have found that people try is, it's in the head. Like when they run out to buy all of these different kinds of milks, cow's milk, sheep's milk, goat's milk, right? The nutrition profile is dense. It's a good nutrition profile for, children not on the spectrum, or for cows, sheep, and goats. It is a really good nutrient profile. It's not the same nutrient profile if you're extracting the juice of almonds and, calling it almond milk. Just because you call it milk doesn't make it milk. So, if you want to use it for something, for some recipes or just as a snack to drink, that's okay, right? I remember I used to make it at home, and I would actually add curcumin or turmeric to it, a little bit of ginger, a little bit of turmeric, and warm it up and use that as anti-inflammatory. But it's not necessary. Please don't run out and buy camel milk. That is one thing that I've seen many parents do, and obviously it won't apply to 100% of kids who are immediately put on camel milk. But in my experience, more than 95% of children on the spectrum have pandas. And if you introduce a highly volatile, I was going to use the word volatile, but yes, I think I'm going to go ahead with that word, because it can have a volatile interaction in the gut because of the excessive antibodies that come from camel milk. Remember, a panda's child is already producing excessive antibodies that are attacking the tissues of the child's own body, the brain, the gut, the thyroid, sometimes the skin. So when you introduce camel milk that has these, I mean, camel milk is superfood. If you want to listen to my podcasts and lectures on camel milk, but at the right time, it has to be done at the right time for it to be beneficial. Some children don't ever need it.
And not for all the kids, because some of them, even they are healing themselves, they still have like a high autoimmune profile, so they still can't use it. Even if they are okay and doing well, they still can't use it.
Yes, absolutely. Now, Brian has been using camel milk because, it has benefited him. We added that at the right time, but even now, even to date, anytime there is a PANS flare, and nowadays PANS flare for us, it will be like just like you, Alexander, just a couple days, right? We don't do camel milk for a whole week after, just to allow the immune system to come back to normal. Sometimes even 2 weeks, depends on if there is a lingering cough, etc. But the person has to be completely, I mean, and I'm talking about an adult now. And I know I'm saying PANS flare, but adult PANS exist, but that is another podcast because research has been done on that as well. So great. So Alexander, you want to go ahead and share Philip's labs?
Yeah.
The calcium levels, yeah, you can share.
Let me know if you're able to see it.
Yes, we are.
Oh, if you see right at the bottom, the first testing, we had testing at the beginning.
So here, yes,
And it
here.
was low in calcium, but I don't have that testing with me. It's been done in December 2022, and it was 241, and it was within the range. And this one has been done just in October 2024, and it has grown a bit, but is in the range, although he is on a dairy and gluten-free diet. So
Yes.
we don't need dairy to keep our levels up.
Yes, I mean calcium, and we don't have to go over all the vegetables and the fish and the eggs and the chicken, all of this healthy foods that can increase calcium levels in the body. The key is healing the gut, calming down the autoimmunity so the body is able to absorb all of the nutrition that the body needs from food. So, I mean, I know vegans. I mean, I have been raised vegan, and I've never had any kind of a calcium issue my whole life. I mean, right into my old age. It's just, I mean, knock wood, of course, but it's just really interesting to me how people, in all different age groups become obsessed with calcium, right? Premenopause, postmenopause, oh my God, calcium, da da da. I mean, again, that's another podcast, like little children calcium, but here we go. So you're saying that prior to December 2022, Phillips's calcium levels were low.
Yeah, they
right?
were, no,
In the beginning.
basically before me stopping him to be breastfed. It
Yes.
was just before he was 1 year when he started to be like really, really sick. We had a blood test and that was low, not very, very low,
Just
but
a little bit
a
lower.
bit
Okay.
low. But then we went like, because I was breastfeeding him at 1 year and 4 months, and he has already started this journey. I didn't eat cheese and milk and anything that would have considered
Ah,
dairy. So
okay.
because I took it off, his level started picking up. So he, even if when I started the treatment when he was 1 year and 1 month, I became dairy free and gluten free for the period that I was breastfeeding him
Okay.
for the next 4 months, and he recovered well.
Okay. So that is, again, another interesting point. If you want to stop sharing, I'll mention this. Thank you for sharing. Um, you know, if you have a child that shows up low calcium, don't panic. Follow the diet. If you have a child that is on the spectrum, we are discussing children on the spectrum. Um, you know, it's okay to go on the dairy-free diet. You don't have to rush to supplement with calcium unless obviously, if it is life-threatening, etc., you can work with your pediatrician. We have to put that information in. But anyways, your typical GFCF diet for a child on the spectrum that many parents follow is fine. Because you know what? Once the inflammation calms down, because you've taken out all of the inflammatory foods, then you will see that the body starts to absorb the calcium. The body, it's a brand new body, right? It's a young child. So when you heal the body is fully capable of healing. And you will find that the nutrient absorption gets better. And once the nutrient absorption gets better, what happens? The cells are not feeling the lack of minerals and nutrition anymore. And then what happens? Inflammation comes down. Your detoxification improves. And then what happens? If there are heavy metals, that becomes part of the detoxification as well. You can be doing, you can be doing chelation product. Alexandra, I have one mom, she mentioned she did like 22, 24 rounds of some kind of chelation program, and at the same time, she wasn't fully GFCF. So it's like, it doesn't make sense. You have to.
When the calcium level was low, and I'm so sorry that I don't have that, it was a blood test. But when we done the hair mineral test, we have seen why it was low, because the other minerals were imbalanced. The minute you start to balance them, then the levels go up to normal. So that's not going to be a problem. And as we've seen, now we've got normal levels.
That is correct. That is correct. And one thing I forgot to mention, Alexandra, was I was discussing heavy metals, right? And I've seen this in labs all the time. And those of you who follow my conference lectures, I present labs, I share labs from different patients all the time as well, that you will see that the heavy metals are extremely high. The mineral deficiencies is really poor. A child has a lot of mineral deficiencies. Then we start reducing inflammation. We start the antimicrobials, reducing the infection, obviously all with herbal medicine. And eventually, the heavy metals start to come down without any heavy duty chelation. Why is that? Simple fact, right? When your cell is mineral deficient, heavy metals are the so-called bad minerals, right? So when your cell is deficient with the good minerals, then your cell holds on to whatever minerals are available. At least they are minerals. So it'll become really challenging to do any kind of chelation, or if you're not seeing your heavy metals come down, test after test, or like this mom did 24 rounds of some process, so I don't want to mention names, but I think you know what I'm talking about. So she did. So there are many approaches that are very beneficial, but I always say you need two things: the right practitioner and the right approach in the proper priority, the order of priority. The approaches have to be introduced at the right time.
And can I add something else that
Of course.
really need? Patience. You need patience to see the result, because we can't see things that have been there for years getting better in a week or in a month. We need patience to see the child recover from was not okay.
Agreed. Agreed. Yes. A lot of patience is required. You cannot rush into things. You have to stick with the diet, stick with the program, stick with the regimen, the protocol. Yes, it does require, Alexandra, many times, as we've seen with us, right? Our children get many toxins and infections from us as moms in utero. Now, if these infections and if these metals and toxins are part of the fetus growing, developing, of course it is, part of the cells of this little child. How do you expect, a quick, if you are doing that, you're putting tremendous stress on a young child's body. If you're expecting anything rapid and quick, there is no rapid, no quick, there is no magic pill.
Exactly.
Oh, all right. So on that note, I think today's podcast was very informative, and we will pause here, and then we will be back in a few minutes to discuss about PANS, PANDAS, and lab evidence and what is the important factors that your pediatrician may not know or may not inform you when you go in for the strep test or rapid strep, etc. All right, so thank you for joining us for today's podcast, and many thanks to Alexandra for your time.
Oh,
And I'll see you at the next episode of Autism Uprooted. Until then, take good care and namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.